and social work, please enter the sign-in code, and I will announce it shortly, into the sign-in link that you will find in the chat box. The sign-in link will be live for about 15 minutes. So please make note of this. I know we had situations yesterday. You have 15 minutes to get this code. Also listen for the sign out code place. It's going to be also in the sign out link found in the chat box towards the end of the session. Again, the link will be live for about 15 minutes. Be sure to include your name and the license types for your CEUs when you fill out the conference evaluation. You must complete the conference evaluation for your CEU to be processed. You will receive your CEU certificates as soon as possible after the conference at the email address you used to register. We hope that everyone, regardless of CEUs, will complete the conference evaluation. The conference evaluation link will be posted in the chat box, in the break time slides, and on our website. Throughout the conference, please only use a Q&A box to post questions for speakers related to the presentation. Use the chat box only for technical questions and to find the CEU sign in and sign out link. I will follow the Q&A box, combine like questions, and share them with the presenters after the presentation. Personal information can be seen by all, so please consider this when posting in the chat or Q&A boxes. So I am going to give you right now the sign-in code for the session, and it's going to be 74. 74 is the sign-in code for your CEUs. 74. Okay, at this moment, I would like to introduce my friend, my sister, Ann Hemke.
Thanks, Olga. You've been doing a great job. I mean, and the thing I like about this virtual stuff, it really keeps us on time, doesn't it?
It does. It really does. Thank you, Ann.
Yeah. So I want to welcome everyone to this working session. Not just a breakout, not just a workshop, but a working session. And what we're going to be focusing on this afternoon is how communities, and I mean like congregations and nonprofits and governmental agencies and businesses, how we can work together as a community to help bring service and compassionate care to people who are suffering from mental illness. And in fact, what I'd really like for us to think about is to think about it in terms of community health and community wellness. That, of course, this is about individuals, it's about families, but what we're really talking about is rallying together a community. Now, not too long ago, we just heard from Jermaine out of St. Louis, and he talked about those bridges to hope. And so that's one of the things that we want to talk about today, and we will. But just because that came from St. Louis, and we're going to be talking during this working session specifically about San Antonio, this kind of conversation, this working type of conversation, is applicable no matter where you live in the country or where you live on the planet. And so I want to encourage and invite our other folks who are listening in, who are not from San Antonio or St. Louis, to be thinking about how does this translate in your own city, in your own town, in your own community. So what we're going to be looking at now, it's a slideshow, but it's also on the internet, online. The first part of our working session is to address how we can access resources that are supportive to the work that we're doing, resources that can help us personally, resources that could help our family or our friends, resources that we could be going to when we're helping people we've never met before, or in our own nonprofits or organizations and congregations. This is a great resource to go to. And so the ones that you're going to be seeing, there are a lot more resources actually in this directory. It's called the San Antonio Community Resource Directory. Our shorthand for it is sacred.org. It's one letter short of sacred. So it's SA, San Antonio Community Resource Directory, CRD.org. And so you can find it. But these are just screenshots of the organizations that are doing work that you would want to be resourcing for those who are in need. But as Jermaine had talked about in terms of Bridges to Hope, these are also the resources that we are partnering with. So it's not just about one organization doing the work all on our own, but that we're working together and partnering. I'm the faith liaison for the city of San Antonio and the community faith-based initiative through the city. And its entire role is to help congregations, nonprofits, government entities, community groups to intentionally partner together, form partnerships, work collaboratively, and network our services together. So that's what we're talking about this afternoon. How can we do that? And by looking at these resources and these other entities, they will give us ideas, and these are the resources that we would be connecting to. Our panelists, or I should say our conversationalists this afternoon, represent some of these organizations. So you might be taking note of these. The beauty too of sacred.org, it does live resource mapping. So you can see that on the screen there to the left. And when you're actually online, it's very interactive and it moves. So it's beneficial in that route. The great news is that when you enter into sacred.org, you do that by zip code. So the beauty is it finds the services in proximity to where the needs are and not necessarily all the way on the other side of town. So as San Antonio grows larger in terms of population, it's going to become even more and more essential that people are able to find resources that are closer to where their needs are at, to where they live or to where they work, where they go to school. And so this kind of resourcing and mapping can help to do that. Now, one of the things the designer of sacred.org, Bill, has put together a short video. We're not going to be showing that now, but he's going to be putting that link into the chat box. So that link will take you to like a 5-minute video at some point. It's really easy to use, sacred.org. And so you can go there and actually go through a really brief training for that. We're going to keep this running, but while we do that, because I want you to see the different ones that are listed there. There we go. It's still moving now. We're going to be using the Q&A and chat a little bit different than you have in previous sessions. So again, the chat box, which is happening right now, and Bill also posted in that tiny link. That will be a conversation between kind of the sidebar conversation, all right? Please keep in mind that this sidebar conversation is being seen on a global scale, but to talk to each other, put links in and that type of thing. We're going to be using the Q&A, and you will find that at the bottom of the screen where it says ask a question. We're going to be using that in a little bit more conversationalist style than you might be accustomed to, say, with a panel. So Doug is going to be facilitating the conversation. I will be facilitating the Q&A box, so I'll be watching for that. But please, we invite everybody who's watching this to consider yourself a part of the conversation. And that's what the Q&A box is for. So when we're talking and conversing, if you have a question to raise to what's happening in the conversation, put it in that Q&A box. But if you also have an idea or a statement, put that in the Q&A box. And if you at any point see a question or an idea or a thought that resonates with you, that's where we use the vote. When we get into the Q&A, you'll see a vote box in the left. So if you see something, and that's the amen, we would call that in the more of a congregational setting. But if you see something that's posted, a question or a thought or an idea, and you're like, yeah, we need to do that, just click the vote box, and that is going to help inform our next steps. And that's why we call today what we did, the next steps. Bless his heart, Doug has been working on this for 5 years, trying to get this conversation going and in place and movement at work. But we're bound determined that it's going to happen this year. Doug chairs the action team for the faith-based initiative on mental health. So we do a lot of work together. And he is like the passion and drive behind Pathways to Hope as the chair of NAMI locally. So we're going to be working together here, and we're determined that we're going to connect and we're going to move this community forward. Somebody else mentioned, and I think it was Jermaine who mentioned it in his presentation, that so many other things are happening through these sites and places that they've developed in St. Louis, that they've been sharing face masks during COVID. Basically, back again to community health, they're building community. And it's around health and wellness, and in particular, mental health, emotional, spiritual health. And so there's just, all this holds so much potential for us in moving forward. So if you would, let's try the Q&A box.
And if I may say a few
Sure.
words. First of all, we're in San Antonio, Texas, in Bexar County, so bienvenidos a San Antonio. There's a saying in Spanish that goes, no hay mal que por bien no viene. That means there are no bad things that don't result in good things. So what's happened here is we have COVID. And because of this incredible tragedy, we now have this conference virtually. And it is brought to us Jermaine. He's with us now to help us and move us forward and give us guidance. We've got Olga and we've got Ann Helmke. Let me tell you a little bit about Ann. She's a little modest. Sacred, I really want to hear from her how it is in her decades of work that this was created, because it was a model and it was implemented, and it's now its own freestanding in its organization. We as a department, I'm the director of the Bexar County Behavioral Health Department. We use it constantly. It's an incredible resource, but it has provided a model. So we have a model from Jermaine, and we have a model from Ann, and then we have other models here in San Antonio. Even for Hope, it's incredible collaborative model. Even some of our provider networks, TRAC and such, are incredible models. So as we move forward, think about what it will take or what you might want to suggest as we move forward to bring together the faith-based community in such a way that a program is defined, that it has clear outcomes, and that we can say, this is why we're doing this. So thank you for having here. It's good to be here, and I just wanted to make those comments. Thank you.
Thanks, Gilbert. Okay, I want to come back to that Q&A box. We've got 2 votes that Doug and Gilbert do great work. Maybe we only have, we have 3 people who are listening into today. I don't know. In fact, if everybody would just vote, then we would also have an idea about how many people are actually participating today. That would be lovely. And Tracy, we see your comment, and that is precisely what's going to take us into the second portion of our working session today. So the first portion, again, was about networking, those resources, access points, our potential partners. But the second part of our working session is to think about how to align and leverage community resources. I'm reading this to make sure we got it right. To promote welcoming and compassionate community-based services and supports for holistic health. And so, Tracy, what you have raised in your question, that's precisely what the rest of this working session is going to be about. So some quick introductions. Look at this. We've got 22 votes. Somebody took a vote away. Oh, there's 22. They're back again. Okay, good. I don't know how that works, but so some more introductions. So Olga started us off, so I'm going to say a little bit about Olga. And many of you have seen her this last 24 hours because she's been moderating a lot of these sessions. Olga is clergy here in San Antonio. She also does consulting work that helps to partner communities. And she's on the mental health action team with the faith-based initiative, as well as one of the planners for Pathways to Hope. So, but in her role in this session, she's going to be bringing all those things and the fact that she lives here in San Antonio and how can we do this work. And of course, I hope that all of you took time to listen to Jermaine's presentation on Bridges to Hope. We kind of put that in as a recommended prerequisite because we're going to be looking at that some more. He directs Pathways to Promise in St. Louis, as well as Bridges to Hope. And he has been working with our mental health action team for the last several months. And we're hoping to see him around more and hear from him a lot as we help, to work at developing whatever we're going to develop here in San Antonio. And of course, Gilbert in his kind words, but Gilbert works for the county, and he is the director of Bexar County Mental Health. One of the things that I learned, and maybe Gilbert will clarify it later, but I didn't know this when I entered into the city system, but our mental health resources largely come through Bexar County as opposed to the city. We work in partnership, but they are the stronger arm in terms of mental health and the work that's being done. So it's been really more than a joy, but I've learned a lot by working with Gilbert. And lastly, I don't even know if I really need to introduce Doug, because as I said before, he's really the push behind Pathways. And the guy is relentless. He just never stops. Every once in a while.
My wife uses other words.
But, about once a month when we're about to meet, I'm thinking, well, maybe we'll take this Tuesday off. And then Doug sends out, okay, we're meeting. Okay. So he just keeps us going, and we're all committed. But so I see that we have 24 votes. So I'm taking that to mean that plus us 5, we've got 29 people in this conversation. That's a good group. Again, use that Q&A as your part into the conversation. I will be following the Q&A. And Doug is going to help facilitate the conversation. So I'm handing it over to you, Doug.
Thank you. Let me just start out by saying sacred.org. Correct me if I'm wrong, and I know Bill's listening in too. If another city wants to use sacred.org, they need to contact you or Bill, and they can build their own map of resources in their cities. That's correct, Ann?
That is correct. Bill, why don't you go ahead and put your email address in the chat box for everybody. Bill is the acting executive director, but he's the tech brains, the tech guru behind all of this. I was relentless with him, by the way, Doug, in terms of forming sacred.org, but technology is not my first skill set. But
I also see Vicki Coffey just asked, trying to vote, find the vote function, not seeing it. Vicki, it's in the ask the question.
It's at the
first question down at the bottom of the screen. So let's get started. Jermaine, I'm going to ask you, because not everybody may have seen your presentation. So I think you have 4 or 5 slides. If you can quickly go through those just to remind everybody what Bridges to Care is, so we're all thinking about the same thing.
Okay, great. Well, I'm going to put in the chat box the web address to Behavioral Health Network STL.org. That way you can go to the site and you will be able to find information about the Bridges to Care and Recovery Program. And so, matter of fact, let's just do that very quickly. Bridges to Care and Recovery serve African-American congregations currently in North City and North County of St. Louis. And to date has worked with 6 clusters, which includes 78 congregations and over 200 plus mental health champions that serve as these connectors between their congregations and mental health providers in St. Louis, Missouri. Bridges has also worked with law enforcement in emergency rooms in order to make sure that we're reducing the use of emergency use, and also ensuring that we work with law enforcement to ensure that we do more early intervention versus things becoming a crisis. Bridges also has a hotline that has been established so that if persons live in North County or North City desire free counseling session, they can call this hotline and get up to 5 free sessions, as well as partner with the suicide prevention hotline as another way to connect. Those slides that you're speaking of is on another machine, and so I just thought I'd give a brief synopsis of what those things were. But go to that website, BHNSTL, Bridges to Care, and you'll get more information about the program there in St. Louis.
First of all, I spent about 4 years ago, I think, Jermaine, I came up to St. Louis. We had a Pathways to Promise meeting, and we had a day with some of the people from the different churches that were involved in the program. We had pastors, we had lay people, we had mental health professionals, and I got to tell you, I was just amazed at the work that they were doing. But the enthusiasm and the need that they said that the program was meeting was, and this was right after the Ferguson shooting, I think, if we recall that. And it was really inspiring, and it really told me a lot about how important this grassroots, community level, church-based, faith community-based program is to people who are living in the community. And so I got to see it firsthand, and I thought seeing Rose Jackson Beavers today gave a good example of how it is to work within a program like that. So we're going to ask the first question, and the first question is for everybody out there in listening in. What did you hear about Bridges to Care, and what do you think? I'm just interested in your reactions. So we're going to.
Boy, I got a lot if somebody else doesn't. I'll tell you. Tremaine, let me just point out some things that you really did quite well on. You started out by telling us what the goals were. Very clearly, reduce stigma, equip congregations, and this one is a really good one for us, and Mike Lazito is out there, divert from health emergencies and the criminal justice system, focus on intervention. So bam, right off the bat. You did it. You talked about how you had a number of congregations, how you had a curriculum that had 20 hours. You talked about your development of welcome champions and your community connectors. And then you talked about a hotline, and then you addressed the fact that you had, for lack of a better word, a brand. You had a plaque when you walked into a church, and people could see there was a safe zone. Mm-hmm. But what I really picked up on the fact is that you said, if I'm in St. Louis and you want to know about this program or you need help, all you have to do is call Rose Jackson, and I can't read my writing.
Rose Jackson Beavers, yeah.
Yes.
Yes.
So I don't have to call a number. I've got a person that I know that I can say, tell me about Bridges to Care. So I thought that was great. And then lastly, most importantly, you talked about got to have a champion. We have a champion. We've got Nelson Wolf, an incredible champion. And bless his heart, we just recently lost our huge mental health champion, Commissioner Paul Elizondo. So we've got champions. So thank you for pointing all those things out. I just want to add those.
Great summation. Thank you.
Well, I liked the mission that you had about mobilizing the church, mobilizing the people within the church, also equipping. That's very important. So there's I can't even say it. So that they can continue with the program that you already have. So I love the mobilization. That's something working with the faith community, I have been seeing that that's not happening in some places. I work primarily with the Hispanic, Latino, and also with the African American churches. So I love this. Another thing is you already have 78 churches that we're trusting. It's just not one. When you have a faith community that's trusting this organization, this program, that means a lot because churches are not very trustworthy with a lot of programs. So I love that about it.
Yeah, one of the questions in the Ask It questions about bringing together those congregations or those in faith communities together in clusters, so forth. And really, what works best is word of mouth. Is that once one pastor,
Mhm.
once she or he have faith in the program, they tell others. And
That's
that's
right.
what makes it work. It is that word of mouth. This is a good program. It equipped us to help our congregation. It can equip you to help your congregation. And that's what has allowed this to spread across North City and North County is that word of mouth from pastor to pastor, from member to member. And so you have to build that trust. And once you build that trust and that rapport with the faith communities, because if you don't have that trust, you're not going to get far. But
That's right.
that comes with relationship building. And
Mhm.
Rose Jackson Beavers is good at building relationships, and so that's where it begins. So, there is a lack of trust in many communities when it comes down to the disparities in health systems. And so, being able to say, "Hey, we can be that warm handoff. We can be that connection for you with the mental health system in your faith community," goes a long way.
We have a question from Perry Rochager about sustainability over the long haul. Jermaine, you want to say something about how St. Louis did that and the importance of a backbone group?
Yeah, one of the major things that's happened with COVID-19 is that when state government budgets get cut, sometimes programs like Bridges to Care and Recovery can be on that cutting block. What has happened throughout the years is the reason why our program has sustained is because we have lobbied at the state level with state legislators to maintain funding for this program. So every time there's a mental health budget that comes up, we have our mental health champions going down to Jefferson City, champion state legislators to keep the funding for the program. So there's a lot of saying, hey, this program matters, this program counts. There's pastors that go down there and lobby on behalf of the program. So it's been a fight every year to keep it in the state budget. But thank goodness it's also county and city and local foundations that support it. So it's not just one funding source, it's multiple sources of income streams that come in to support the model. And so the goal though is the sustainability of the model happens when you train these pastors and these leaders to keep it moving once the funding is gone. And so the goal is to keep that grassroots level so that the work continues after the funding is gone. Because we know priorities change. And so we have to have that local buy-in to keep it moving. I hope
I
that
just
answers that question.
Yeah, I want to just add to that, Jermaine, as well. One of the things that we have seen in San Antonio that replicates that in terms of volunteers and community buy-in is becoming a compassionate city.
Mm-hmm.
So all of that work was done for half a dozen plus years on a grassroots level because we didn't want it to go away when other officials were elected. We wanted it to be a part of the community and the culture.
Yes.
And so, and I see that in your model, that it's grown from that 15 to 78. We have somewhere between 1,300 and 1,400 congregations in San Antonio. So we've got our work cut out for us. But, I'm certain that those 78 congregations in St. Louis, by and large, are doing this because they are committed to it now, and it's a
Yes.
part of who they are. So we're going to have to work at that level. We do have another question here, Jermaine, that goes back to what's the best way to bring so many faith communities together to form clusters? And you said coming into conversation, but I also heard you say food. Now, in your presentation, but we're living in the time of COVID, and I'm not sure how to serve virtual food. So if anybody has any thoughts when we get into the next question about, spreading the word about this, I love to have gatherings as much as the next person, but we're in COVID, so that does make it a little
Yeah.
different.
We've been
So,
talking about having virtual coffees and teas, though. So join us virtually with your coffee and your tea. Let's have a conversation.
Well, in San Antonio, it would be virtual tacos and taco
Tacos, yeah,
sauce.
absolutely, absolutely. It's kind of like bring your own lunch, kind of. It's one of those things kind of where we can have a virtual brown bag session where you bring your sandwich, you bring your whatever, and let's talk about it. So it is meeting the challenge by saying, let's eat together. Let's do our own virtual potluck, if you would. And even though we can't share it, we can enjoy how it looks. So, this is a season of being creative, just saying, man, I wish we could have some of that soul food right there or tacos. But the reality is with this COVID-19, we have to just try to smell it virtually, I guess.
There's another question up here. We'll just keep talking through these questions. How adaptable is Bridges to Care for predominantly white churches, but that have a diverse membership? Anybody want to take that one?
Well, I would just say that Bridges to Care transcends race, denomination, even religious affiliation. The reason why the focus was on African American congregations in St. Louis in particular was because of the health disparities in that particular community. So that's why I was specifically chosen for African American denominations. However, there's disparities across different areas, and so the program itself is not just for African Americans. It is for any group of people who desire to have the passion and the compassion to increase their literacy and to be those champions for persons and families who may have mental illness or addictions. And I think addictions is important that we bring that in too, because we're not just focused only on mental illness, but also addictions. There are people who have comorbidities, both mental illness and addictions. And so learning is not just for mental illness, but for those with addictions and mental illness.
There's another question here. I was surprised to hear such positive response from pastors who are willing to get involved in the Bridges to Care program. Let me just say that, having kind of worked in this area for the last, and Ann's certainly been doing this for a long time, but, at least for the last 10 years, I see more receptivity on the part of pastors and churches today to become involved in addressing mental health than I ever have. I mean, I think the conference has helped. I think this overall awareness within our society has helped. In fact, COVID-19 has contributed to that because we've sort of pulled the covers back and we see how vulnerable everybody is, how we are, and that depression and a lot of issues and suicide, a lot of issues that maybe we didn't talk as much about, but people are talking about them more. So I think that there's definitely a receptivity. There's another comment from Kenneth Donahue that says, I believe that we could initiate this effort in our South Texas Trauma Informed Care Consortium. That's what we need to see. This is exactly what we were hoping for. Your thoughts on how to begin to bring, who should come together, and how can we begin to do a Bridges to Care program. Let's see what else we have.
So you're asking about steps, Doug? You're asking about steps now, like some solid.
Well, the steps are just to get people's, if somebody says, "Oh, I can help with that effort," if you want an organization that has an interest in working with other organizations in the community to kind of help come together to be this backbone group to work with churches, then that's what we need. If you look at the Behavioral Health Network in St. Louis, what's interesting is it's lots of healthcare organizations, lots of social agencies who are all kind of coming together. You have a steering committee there, don't you, Jermaine, at the Behavioral
We do.
Network?
Yes.
you want to talk about the BHM?
Yeah, so that steering committee, I was honored to be the chair of that committee, included our local mental health. In Missouri, we have community mental health centers. And so leaders from our community mental health centers were part of that, from the hospital system, from our regional health collaboratives. So what you had at the table were all the stakeholders, those folks who had the ability to go lead that meeting and affect change. People who at the table go, my budget has this in it, I can help with that. So bringing together all those people who had the ability to affect change in that moment, or go back and try to bring it back to those who could, was very important part of the success of the steering committee. In my days of community organizing, we talked about people move from their self-interest, and the self-interest is what motivates you to act. And so, if we can gather together those partners who have a motivation to act on the well being of others in this area, that's what's going to move this forward. So, it begins with having like minded people with shared vision, shared purpose to come together. And that's how this happens. And I believe that in most cities, you have folks who see a problem and who are trying to figure out how do we help resolve it. And the good thing is San Antonio is there already. So now it's just a matter of bringing together the parties at the table and saying, how do we move forward to make this happen? And I think that may be the case in some other cities too.
Jermaine, that's a really good point. And then I want to go back and point to you. One of the things that you did is you were the bridge spanner. You literally were the bridge spanner that brought together. How do we do this? Well, we get a bridge spanner, we get a consortium, and then I'm going to channel Mike Lozito here on this one. We need data. For those of you who know, Mike Lozito is the director of our Criminal Justice Office of Planning, but he just is adamant about data, and so we have to answer the question, why? Mm-hmm. Why are we doing this? I would say, within our faith-based community, is every one of us on this call want to reduce suffering. We all want to reduce suffering. So that's the why. But we've got to have the data, because our leadership, our commissioners, our councilmen, they need to know that what we're doing is moving forward. I know that we all have great love and all of this, but we've got to get the data.
And that data is what moved people in St. Louis to just health disparities, infant mortality, all those different rates there. And how are we getting these numbers? And when you look at people are just not getting the treatment they need early. So prevention, early intervention. And you look at those things. And so how do we motivate people to get help before it becomes worse? So that data is there where we see those disparities. And so now where do people go get help from first? Faith communities. How do we equip faith communities to be mindful of how to connect those folks to get the help early? So the data points are there. It's like, how do we bridge that to say, how do we make these connections and connect these dots so that we can intervene early, once again, to prevent things from becoming worse? But I agree with you that data is key. Data is key.
I have a question though, Jermaine. Have you been producing metrics though on Bridges to Hope? We have the data on disparities. We also have an equity matrix that we could use. But what's the metrics looking like coming out of it?
So we do have the Bridges Care Recovery. We did do some evaluative work, and so I can share that study that was done with some cluster members, so forth. So we do have some data, because data is very important to show that there is movement. And so, as Rose said, 49% of the calls in the hotline are the result of faith communities referrals. That's powerful. What that's telling you is that half the calls, at least, that are coming in for folks who need help is coming from the work we've done in those faith communities. So those kind of data metrics say that things are working. So we have done some studies to see what the work is producing, and I can share that. information.
There's a question in the chat in the chat box. Please define succinctly what are we trying to do? I'm lost.
Oh.
So I think succinctly what we're trying to do is see what level of interest there is in a Bridges to Care program being implemented in San Antonio, and who would be the agencies and entities and people that might have an interest in helping us launch that and begin to sustain it. So those are, and part of this is we're not looking to drive a solution into the community. We're looking to see if the community wants, if this resonates with people in San Antonio, and if we want to support it. So in the end, we would have churches, faith communities coming together in clusters, being trained, being wellness champions, and with community connectors who would connect them to community resources. So that's about as succinctly as I can state it. Does anybody else want to add anything?
How we work together more and to come up with at least some really great ideas to go into that plan. So one of the things that I've heard, and we can start defining that, but I've heard data and going into the data in terms of disparities to help us focus. So I've heard that's a step. I've also heard another step in terms of connecting with the trauma-informed care consortium, a large consortium across Bexar County and San Antonio, a huge network within every sector of the city. So that's a really great, getting those half a dozen congregations together, frankly, wherever, and we can start working with that. And those are some of the steps that I've heard. There are probably more if I think a little bit.
Yeah. I think one of the things we've talked about, how do we sustain this over a period of time? And one of the, I think if you go to, again, the Behavioral Health Network of St. Louis and the Bridges to Care, there are a number of results that are posted in terms of outcomes. Did people get better? How's this program helped them? And it's been very effective. In fact, it's very cost effective. So in San Antonio, if we look at the work that the Bexar County Health Collaborative is doing and the hubs that they are helping form, that's another resource that we could bring to the table here in Bexar County to help begin to provide sustainability. I see another, I think Nelda Lazito, so she heard Lazito and her ears perked up. So she asked a question, can you discuss substance abuse and how you get rid of the self-inflicted stigma with churches? Mm-hmm. Jermaine, what are your thoughts?
So let me make sure. Can you repeat that question for me one more time?
Can you discuss substance abuse and how you get rid of the self-inflicted stigma with churches?
Yeah. So one of the things that when I was introduced, I was introduced also as a national trainer for the mental health first aid program. Mm-hmm. And, one of the things is looking at the word abuse itself and looking at removing the AB from that word and just look at substance use. We all use substances. Yeah. However, substance use is when a person has developed a dependence upon that substance, and that dependence has then resulted in a disturbance of how they live their lives, how they impact the ability to work or some other things of that nature. And I don't want to go deep there. I think the stigma is removed I tell people, if you're eating a gallon of ice cream a day, you probably have some kind of issue going on. If you can eat, a box of cookies a day, you probably have an issue going on. I think it's one of those things that we all find ways to cope with our anxiety, our depression, and other things. Somebody with a substance use disorder may have been predisposed genetically. and because they're predisposed genetically, had a higher risk of developing substance use disorder than the next person. So we don't criticize folks who have diabetes as a genetic predisposition or hypertension. So the same thing is there. So if my father and my mother um, has substance use disorders, I was genetically predisposed, so I've been more cautious in making sure that I avoid certain things. So I think it's about education. And as we educate folks about the risk factors genetically that may be a result and take away some of that shame that comes along with that, then I think we can do a better job as faith communities.
Jermaine, I'd just like to add, we've got to remember that, the substance abuse is a medical disease. It's just like, you've got diabetes, you've got heart. It is, somebody doesn't wake up in the morning and say, I think I'm going to be an alcoholic this morning. I think I'm going to be a cocaine addict. It is a medical disease. It needs to be treated aside. I just wanted to add that.
Yeah, and I think that's important, that it's an illness, it's a disease, it's real. It's not something that people are, as you say, wake up inside today, I'm gonna be, addicted to a particular substance. I do want to point out that those of you who are looking for data for Bridges Care and Recovery model, if you use that link I put in the box earlier, there's a dashboard for the end of fiscal year 19. There's a dashboard for fiscal year 20 first quarter. Has actual statistics and numbers of referrals characteristics, number of people who've been trained, screening events. So if you go to that website, you will find data points for 2019, the first quarter of 2020, and some other data points there. So the data is out there on the website, and you can download that data in the form of a PDF format. So just want you to know the data is out there on the website. So don't need to email me personally for it. It's right out there for you on the BHN STL website. We're just a care and recovery, but I want to really go back to that ideal that it is an illness and that deserves the same respect as any other illness that is there.
Substance abuse is not a moral failing.
Yes. Thank you, Jane, for putting that link back out again.
We have a comment from Vicki Coffey, who spoke earlier today. Vicki says, really like starting from a place of trauma. Trauma is often the root of emotional distress and usually overlooked. Most people can understand distress from a place of one experiencing trauma, takes the focus off the, quote, mental illness.
Yeah, we know trauma is one of the most powerful predictors, one of the most powerful risk factors when it comes down to mental illness. That's one of the most powerful predictors and risk factors there. And I think that one of the words that I've been working through the companionship movement to ensure that when we talk about suffering, that we also don't give the impression that folks with mental illness are always suffering. Folks with mental illness often want to make sure people don't look at them as just sufferers. And so we often use the language now, persons in distress, because we all experience some form of distress of some kind. And some persons' distress is greater than others. And so when people are in distress, how we assist those persons in distress is very important. So I could be in distress, but not be suffering. So I think we should.
Yeah, that's a great point, Jermaine, and one that in mental health, a lot of advocates are trying to discourage the word suffering. I saw Vicki also posted in an additional comment, for communities of color, trauma is rampant, yet we often fail to call it out or intentionally don't as a coping mechanism. And she says, yes, Anne, including education about resilience when discussing trauma is great. I want to go back to something that I think it was Vicki that talked, or it may have been Dan Gillison, but I think it was Vicki, the percentage of mental health professionals in the United States that are African American. I mean, we're at 2% on psychiatrists, 7 or 8% on psychologists. And I think, and this idea of needing to be able to talk to people that have a similar background or similar experiences, somebody who can be empathetic. And there's been some great national news segments on this over the last couple of months. But I think this actually goes directly to the idea of bridges to care, and why, for example, in African American churches, and if you have wellness champions, you have somebody you can go to that really, if you have a lack of African American psychiatrist or therapist, well, if you want somebody to be, to understand more about your experience, where can you go? Well, one of the places is to be able to go to the wellness champions, to the people who are trained, and to the and to the connectors. Is that true, Jermaine? Has that been one of the strengths of Bridges to Care?
It has been. It's been having that warm handoff. So what we did early in the Bridges to Care recovery program is we created a program, in that program, a position called community connectors. Those community connectors were affiliated with local federally qualified health centers. And so those staff persons that was part of that FQAC or mental health organization worked with the congregation. So they were faced there in that congregation. So no longer was it going to meet a stranger, but there was a connector that was connected with that faith community and that mental health provider, which made for a warmer handoff. And we encourage mental health champions to volunteer to go. I'll go with you to the doctor. I'll sit with you in a waiting room, so that that person didn't feel ashamed. And the reality is that, and we discovered that some folks who would go get help would drive miles from their local community mental health center to another place away from their home to get help because of the shame. So they had a provider right there in their community, but they would drive 15, 20 minutes to another provider to see somebody for fear of somebody seeing them go into that place to get help. So once again, that shame and that stigma, even though we're offering that help, we still have to work with that right there. So having a friend go in there with you, that right there can be a game changer. And so once again, that warm handoff is what made this really work.
Jermaine, and we also have a question about this. One of the things that my ears just really perked up in your presentation was about the 5 free counseling sessions, right?
Yes. Yes.
And I was just like, wow, because our waiting list in San Antonio is long. How is that supported? What's the infrastructure that provides for those 5 free sessions?
Yeah, so we got funding from our Department of Mental Health. I believe that supports the cost for that. So basically, Behavioral Health Network entered into a contract with these mental health providers, and with that contract, when our referrals come in, then we track that the referrals come in. We don't have names of people, so we're not getting actual names for HIPAA's sake, but we are tracking number of sessions. So we can track the number of people who've been seen. And so that's one way we track that. So with that funding from our Department of Mental Health and other funding sources, it allows us to pay for that. We knew that one of the barriers to care was affordability. And so if we can get those first 5 sessions there, a person can get the initial help they need. And then once they get that initial help they need and possibly a diagnosis, then they can move forward. And we also have them apply for Medicaid or other funding so that at the end of those sessions, they can have some kind of funding source to pay for continued treatment. So once again, most folks won't go for that first session because they say, I can't afford it. Well, that barrier has been removed now. Here's 5 sessions that you can go to get the help that you need. And we've had whole families go get help because the reality is what we've discovered is that the father, the children, the mother, all those folks experience some kind of trauma as a whole and need help together. So that funding has made that happen.
Thanks, Jermaine.
Yes.
Anne, I'm putting a question up in the question box, and I just said, if you're associated with an organization, an agency, a church, a program would you be willing to be part of a community collaboration to support Bridges to Care San Antonio? If you are, just let us know who you are. I mean, that's part of what we're trying to do here is say, would you be interested? And I've seen a number of people in the chat box that I think already, you're already doing a lot of the work. So we're talking about trying to organize this to help support faith communities and clusters of faith communities.
Yeah, and I just put in the chat box because sometimes I've been on these kind of things and people are like, count me in, and they give their information here, and then we lose it. So I'm putting in my email address. So if you are interested in helping, at whatever that means, and to continue in this conversation, email me so we don't lose that information. So I put it both in chat and in the Q&A. We've also set up 2 follow-up conversation times to this, and Bill's going to post that in the chat box for me. But when Doug and I were talking about this, we were like, well, we should have the next time so then people can go ahead and mark their calendar where we're going to continue this and what's going to happen next. And so we set up, I think we set up a morning time and an evening time, and you could come to one or both. But those will be coming up in the chat pretty soon. So you could copy and paste those someplace into your calendar. You don't need to RSVP or anything. Here they are.
Yeah. There was a question that came up about how is program effectiveness evaluated. Bridges to Care Recovery has contracted with a group called Tri-Rest Group. And that group there, one of our senior evaluators, also board member of Pastor's Promise, Jim Sennheiser, is the evaluator for that. So we evaluate the pastor, we evaluate the wellness champions, we try to evaluate those folks who are being handed off to get those kind of services, so forth. So that company, Tri-West, is the group that does our evaluation. So we're asking folks who are actually receiving the training and the services how effective it is to them. And that's how we're getting the data. And that's what drives the program moving forward, is that we are getting from them, what can we improve? What can we make better? What other trainings do you need? So getting that feedback directly from those who are receiving the service has been essential to continue to evolve this model. So I hope that answers the question about how we are measuring effectiveness.
So measuring effectiveness is such a critical component. There's a thing in psychology that's called the scientist practitioner model. That is the application of science to the practitioner. So that's what really drives, especially our leadership. So roughly speaking, so you have the program, you've got a program. How many people has it served and kept away from the crisis center, a crisis facility? How many folks that are in that program maintain engagement with that treatment regimen that's been prescribed? And finally, how many folks that have been involved with the law and criminal justice? What's the recidivism? Do they keep being rearrested? Are we actually doing something? So those are some measures that would be pretty important.
Okay, while we think about those, I also added another question. If you're associated with a faith community, would you be willing to be in a cluster with other churches? So go ahead and just tell us, hey, this sounds interesting. I've seen some the names of some churches that are already doing this work. And so the question is, would you like to be in a cluster with other churches so you could work together, share resources, build a more robust program? So please let us know how you feel. And and you posted, let's see, September the 3rd at 1:30 with a Zoom link, and September the 3rd at 6:30 with a Zoom link. And so those will be 2 follow-up opportunities for people where we can dive a little deeper, get a little more commitment, give people a chance to think about this and answer some more questions. What else do we speak?
Do you have any suggestions where to start with limited funding, especially as governments are cutting budgets these days? I'm wondering, are there monies within CARE, the funds that have come out of COVID, because we already know the mental health aspect of our world is being, doubly impacted. We heard from Ben O'Dell, the faith liaison with Health and Human Services, that the federal hotline has increased by 1,000%. 1,000% during COVID. So, I mean, I think Gilbert would probably have a better answer to, funding outside of the usual budgets. Is there other?
Let me answer that by a quote from the Buddha.
Okay.
You'll find the money from wherever it is. These are times of the unimaginable. And right now, City of San Antonio, Commissioners Court, as you mentioned, everybody is hurting. Everybody needs the resources. We're having to make very critical decisions on who we're going to fund, but that shouldn't stop us. It's incredible when you have an idea and you bring it together, folks. It will come. Folks will come. We just have to do the work, I think.
I think Gilbert, just to build on that, I think it's one of the ways that happens is to have those virtual tacos with people. I think you have to begin in conversation. We begin at a conference like this, and I think people just have to come together and say, we recognize the need more than we have ever before. The need is there, and I will tell you from talking to people want to be engaged. People want to provide solutions. So one of the things it takes some leadership. And the other thing is that I've noticed, and this is through my NAMI Faith Network, every community is different. Every community has a different group that's sort of spearheading some of these. So it's looking at kind of who's in this space and who wants to be engaged. And I think in this day and time, we've got an overwhelming number of people that want to be engaged. We just need to give them a way.
So I just see
it's one of the next steps.
I just see in the chat from Nelda Lozito, governor's office in Texas has funds. We should all be contacting the governor and say, hey, we need to use these funds. It's great.
Well, I will say that there was just a grant, I won't say to whom, but there was a significant grant from Health and Human Services to a church in this community to do very similar work. So I think that part of this is organizing ourselves to be able to put together the proposal, the request. And you and I've talked about next steps. And I think we know what some of those next steps are. And so I think we just have to take the next step to get organized and pull our group together and have our proposal ready. What other questions do we see that we need to answer that we haven't really answered?
Well, Perry asked who works closely with Meadows MHPI. I don't know. Perry was at, I don't know whether that's meeting organizations or how that question is formed. But that information from Meadows is also critical to what we're talking about, along with the health disparities, equity matrices, things like that. We need to do a lot of mapping, and we can do that rather quickly.
We have another question. We have a Stephen Ministry network of churches. Could that be a vehicle to implement a program like Bridges? And I would say definitely. I mean, we need to. They should be at the table. And I think one thing that helped me was looking at the Behavioral Health Network of St. Louis and seeing the variety of different organizations that are involved. Also, Vicky Coffey, who I think is listening in, Vicky's part of the African American Behavioral Health Network in Austin. And, they pulled together a group of African American. They've had a conference up in Austin with African American churches on behavioral health for, I'll probably get the number wrong, but it seems like almost 15 years. And they came together. So this is very doable and possible. So we're going to steal Vicky from Austin and bring her down here.
Well, I'm hoping that when we have these 2 Zoom meetings, which we can get a lot more people onto the screen and talking, but that Jermaine will come and join us, and I'm hoping Vicky will also come and join us, that we do get some folks outside of our community that has some of these other components. So Jermaine, that was my official invitation. And Vicky,
Vicky is still here, 21 years, Doug. Wow.
21.
21. Wow.
Yeah.
That is utterly amazing. And I encourage everybody to just go to that website and look at their program offerings. I mean, it's really impressive. So when we talk about, well, what's being done in communities of color and, for mental health, I mean, just call Vicky. She knows it all. Vicky, I'm going to load up your phone line.
I'm also thinking, Doug, that if anyone out there, congregations, are already in a relational network, in proximity to each other, whatever that, there are congregations. We've got several of those, probably more than several. I know of several in San Antonio, and there are probably more. So if you're already kind of have a cluster, an ecumenical interfaith, congregations that are near each other, already working together, this would be like an easy, natural next step. We can never learn too much, right? And so if we haven't had the training, just to get the training would be huge.
Yeah. So I think we have a great model to look at. We have Vicky just said, please keep me in the loop. SA is just a short drive from South Austin. Mm-hmm. She says, and I don't know it all, but know lots of folks. Well, I think Vicky knows she knows it all more than anybody I know. I think, Ann, we probably need to bring this to a close today. We've been on about an hour, a little over an hour. I think we've gotten some great feedback. I've seen some churches on here, people from churches that I think will be good next contacts, and we'll reach out to them. But I think I want to emphasize how doable this is. This is very doable in our community. And I think with the wonderful example that Jermaine has brought to us with St. Louis, and hearing from Rose Jackson Beavers today was wonderful. We're prepared to take the next step. Any of y'all want to, say anything today before we close out?
Yeah, I'd like to hear. This is what I'd like to hear. I'd like to hear from folks. If you could say one thing, and you only had one opportunity to say it ever in your lifetime, to our faith community, and I'm going to say in San Antonio, but to any faith community, you only had one time, that's it, in your whole lifetime. What would you want to say to them? How would you, I don't know whether it's encouragement or challenge or affirmation or whatever, but I'd like to hear what that is from Gilbert and Jermaine and Olga and Doug and anyone else that wants to post on chat or the Q&A. I don't care.
The response is very, very automatic for me, and that is, we are all family. Mm-hmm. We are all family. So.
The word I would use today is help. I see so much need out in the community. Access to care is the single biggest issue we face. we have a way to address this. How can we not? I mean, we're just called to do this. We're called to help people in our community, and we need to provide some help.
For me, would be love, because when we love people, we're going to do everything we can to help, to be there, to listen. So love can do a lot.
Yeah, Olga, we're on the same page there. I was going to say love and kindness.
Mm-hmm.
Love and kindness is what draws us together. Love and kindness. And so let's show love, let's show kindness.
Yes.
And for me, I wasn't thinking about this before, but I would encourage our faith community to keep translating the golden rule in as many ways as possible. To serve others the way you wish to be served, to care for others the way you wish you would be cared for, and to not treat others in ways you don't like to be treated.
Mm-hmm.
Respect others the way you want to be respected. Don't dishonor people the way you don't like to be dishonored. Just keep translating it. Open your hearts, open your arms in ways that you wish that others would do so to you.
Very good.
Walk through the door, a possibility, the way we wish others would walk through that door for you.
Now, I keep thinking about the parable of the Good Samaritan, and
Mm-hmm.
he's the person that stopped and reached down and helped. And how many
Right.
times we walk by somebody
That's
that
right.
needs help and we don't stop. This is a time when, and maybe it's a good time that we're all in this COVID world, and we have some time to think too. And we are a little isolated, but maybe it means we need to really think about how we spend our time and what we do. I see wonderful things coming in over on the chat line. And I want to remind everybody, September the 3rd, I think that was just posted again at, let me get the times, 1:30 and 6:30. You have the Zoom links. They're already set up. We're going to reconvene again. And what I would invite people on this session to do is, hey, spread the word. Let's get some more people in the Zoom room. Tell your other, churches in your denomination. Tell other people on your block. Tell other people you work with. Tell them to come to the Zoom room and be part of this conversation.
That's right.
So shall we close?
Yes, but before we close, let me give out the sign out code. Because I'm looking over here to the right and they're saying, what is the sign out code? Okay, everybody, 31 is the sign out code for your CEU.
Bingo.
31.
And then, Olga, what about filling out the questionnaire at the end of the conference or at the end of the session?
Make sure all the links are being posted on in the chat box. So make sure that you fill those out. Go on those links and fill out the evaluations and turn in your CEU as well, okay? And Doug, so are we ending it here or are we going to go somewhere else?
We are, everybody on this call deserves a lunch break. So I think we're done with the conference. This is, I'm still sort of thinking through, I think we've had great sessions.
We have.
My biggest disappointment is that I couldn't be with people and hug somebody and just see people personally. That's been the thing that has been such a joy with the conference each year. So I think we have to do this a little distancing. It's been great. I want to thank everybody on this call in particular for everything that you've done to help with the conference. I want to thank everybody that's tuning in right now. Thank you for listening and thank you for being part of this conversation. But it doesn't end here. The work's just beginning.
That's right.
Yes, that's right.
I have one more request.
Yes.
I'm wondering if Jermaine would bless us out of here
Please.
and into our future.
Let us take a moment. It's with gratefulness that we come, and we pray that we will be the light and the hope and the love for someone who needs it most. Amen.
Amen.
And all the people said amen, and thank you very much. And we will see you soon. It's September the 3rd, if not before.
Yes. All right. Thank you.
Okay, if Nowcast is listening, we're signing off.
Bye.
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 Thank you.
Thank you.